With us now is Dr. Tom Grabowski, a neurologist and the medical director of UW Medicine's Memory and Brain Wellness Center. Thank you so much for joining us.
Yeah, thank you for inviting me.
So tell me a little bit about this Memory Hub. You guys provide a lot of services here. What specifically do you offer for people who are struggling with memory loss?
Yeah, so the Memory Hub is it's really been our dream project over the last few years and just opened this last spring. A nationally unique model for creating a community center around memory loss and dementia for our patients and for the community, where we model a community of support for people living with memory loss. In fact, you can think of this as like a third place, a lowercase third place, where you're neither a patient nor a participant in our research studies, but a person with memory loss. And this is where you can come for support, for programming, for interaction with our aligned partners like the Alzheimer's Association, Full Life Care, and Elderwise Adult Day Program.
So someone who has memory loss or dementia, they come here. What kind of programs can they have access to?
So we have educational programs where we introduce people to our program, to a handbook that we've developed to help guide people to live well with memory loss. We have a program we call ADAPT, which is a 2-week mind and body wellness sort of boot camp for people with early stage memory loss. That's designed for a patient and a study care partner, usually a spouse, sometimes an adult child. And that works on a principle of compensating for memory loss by tapping into your strengths, because everybody with Alzheimer's disease and related problems has strengths to work with.
Alzheimer's can be a very isolating disease for people who have it, but it also takes a toll on caregivers and family members. What kind of services do you offer to them as well?
Right, so we have, so Alzheimer's disease definitely affects the whole family. So beginning with our sort of 90-minute Zoom class, which we designed for the patient and family. And well, even before that, beginning with family conference that we might carry on in the clinic, to disclose diagnosis and talk about designing a care plan that involves the whole family. And then we have other programming here as well. We have a weekly online support group for caregivers. We have a program that's led by Full Life Care, which does caregiver training using evidence-based principles developed at the University of Washington.
So very much a very family-based approach here.
Yeah, and integrated, right? Yeah. So we think it's really important to build a dementia-friendly community, as well as to work with individuals in terms of a strength-based kind of approach to their care.
As you know, the Alzheimer's Association estimates that about 6 million Americans live with the disease, and that number's only growing. So as a doctor, what are some of those early signs that you look for that someone might need help?
Right, so one thing is we often find that people are having mild memory problems for some time before they come to attention, and we're really striving to make a diagnosis early. So for most people with Alzheimer's disease, some of the early signs are going to be trouble remembering recent information, repeating the question for the same information, so having trouble retaining.
We all forget things, right? We forget where we put the keys, we forget where we're going, but what's the difference between something basic that we all go through versus something much more serious?
People are when it's called to their attention that the information has been there before and they don't recognize it, that's usually a sign that something is more serious, and especially when it's something important like an appointment or important news. We all have trouble retrieving names and words at times, and it doesn't add up to a functionally significant problem. But if your message is compromised, if you can't get the message out, that's a problem.
Let's talk a little bit about treatment. Recently, a new drug came on the market that slows the progression of Alzheimer's. It's not a cure by any means, but as a researcher, as a medical professional, are you optimistic about drugs like this coming onto the market?
I do think that we're in an era where we're going to start to see medicines that do slow down Alzheimer's disease. Maybe not reverse it, maybe not completely stabilize it, but we're going to slow it down, I believe, in the next few years.
You said you're optimistic. So will we see a cure for Alzheimer's in our lifetime, or are we talking generations down the road?
I think you will definitely see effective treatments. where we slow the process down. And one thing we haven't talked about is Alzheimer's disease process occurs in the brain years before people have any symptoms. One of the more recent developments is we're learning how to track that presence of Alzheimer's disease in the preclinical period. So this is coming. We will, in the next few years, have blood tests that track this, and we'll be able to detect in advance. And then these treatments that you're hearing about, we'll be applying them to people who don't have symptoms yet. Because the way the math works out, if you could just slow the disease down by 5 out of those 15 preclinical years, then you would cut dementia in half. Okay. So I think prevention is actually a realistic approach in the end.
Anything else you want to add in terms of research or here at the Memory Hub?
Well, we do. So the University of Washington is also, one of the longest-running Alzheimer's disease research centers in the country. We're closely connected to the Memory Brain Wellness Center, working on different aspects of the biology of Alzheimer's disease, working on brain imaging, working on biomarkers to detect the disease early. We try to give patients an opportunity to participate in these studies if they want, although it's always optional, of course. Yeah.
Okay. Dr. Tom Grabowski, thank you so much for your time.
Yeah, thank you very much.
If you'd like to learn more about the Memory Hub, you can visit their website at thememoryhub.org.
Watch CityStream Tuesday nights at 7 on the Seattle Channel, or find us anytime online at seattlechannel.org.